These are Pontine syndromes caused by ischemic infarcts. First, this is the circle of Willis, and it's worth noting where the pons gets its blood supply from. It usually gets its blood from the basilar artery, specifically the Pontine arteries, as well as some from the anterior inferior cerebellar artery, the AICA. And we'll see what infarctions in all of these do, what Pontine syndromes they cause. First, an infarct of the paramedian branches of the basilar artery. This causes an inferior medial Pontine syndrome. You'll have contralateral hemiparesis, that's pyramidal tracts. You'll have ipsilateral damage, such as abduction palsy, such as for the abducens nerve or cranial nerve 6. You can have ipsilateral facial muscle weakness, again, facial nerve and cranial nerve 7. You'll have internuclear ophthalmoplegia. This is damage to the MLF section. Damage to the MLF results in impaired lateral gaze due to impaired adduction of the eye ipsilateral to the MLF lesion in the pons. This results in nystagmus of the abducted contralateral eye. Next, infarction of the basilar artery can cause a ventral Pontine syndrome. Contralateral hemiparesis is common here as well. Ipsilateral, you'll have an abduction palsy, again affecting cranial nerve 6, just like we saw up here. And you'll have facial muscle weakness, again affecting cranial nerve 7. Lastly is the infarct of the AICA, or the perforating branches of the basilar artery. This can cause a lateral Pontine syndrome. In this case, you'll have contralateral loss of pain and temperature. That's because the lateral spinothalamic tract is affected. Ipsilaterally, you'll have facial muscle weakness, decreased salivation and lacrimation, loss of taste from the anterior 2/3 of the tongue. These are due to damage to the facial nerve and cranial nerve 7. You'll also have an ipsilateral Horner syndrome. The sympathetic fibers are affected here, so patients will have meiosis, ptosis, and anhidrosis. You'll have limb and gait ataxia. That's a result of damage to the middle and inferior cerebellar peduncles. You'll have loss of pain and temperature sensation in the face. That's from the spinal trigeminal nerve nucleus and cranial nerve 5. You can also have ipsilateral vertigo, nystagmus, and hearing loss. That's because of damage to the vestibulocochlear nerve nuclei, cranial nerve 8. If the labyrinthine artery is involved, you can also affect the labyrinth of the inner ear. I hope this review of Pontine syndromes was helpful, and thank you for listening.